Hi, now let's continue our physiological principles of circulatory system. So today we're going to understand the anatomy of the heart and the electrical system that generates coordinated contractions of the heart as a pump. So first, let's thinking about heart anatomy. So to make it easy, we have ways of showing the heart like this. So assume a person is facing towards us, then his or her left side and right side of the heart would look like this. So this is left side of him, and this is right side. So to make the heart as the simplest four chamber diagram is this. So that's basically one right atrium and right ventricle, and this side as a left side for towards this person is a left atrium and left ventricle. The atria or atriums are basically the role is sending the blood to fill the ventricle. So the atrium doesn't need to be very muscular, while this ventricle has to pump the blood. One is throughout the pulmonary system, lungs, and the other left ventricle is pumping throughout our body. So it has to be very muscular. So for that, let's take a look. So right atrium gets the blood from all of the body as a vein called the vena cava, and then that deoxygenated blood will enter into right ventricle, and you have to send it to lungs. So that's going into pulmonary artery. After the lung, the blood gets oxygenated, and that oxygenated blood will enter to the left side of the heart through pulmonary vein and entering into left atrium, and that gets into the left ventricle. And this left ventricle is the main workhorse of our heart. It pushes blood throughout our body via aorta. So four chambers composed with the muscular walls is our heart, and it contains right and atrium and right ventricle, left atrium and left ventricle, or atria or ventricles. And it, as you can see, it has 1, 2, 3, 4 inflow and outflow tracts. So that inflow is vena cava, which means it's a vein, and cava comes from Latin hollow vein. And it goes out towards our lungs, which is pulmonary artery, and then oxygenated blood gets towards the heart, which is pulmonary vein. Interestingly, the blood in pulmonary artery, in fact, are deoxygenated. Pulmonary vein, it's a venous blood, but it is oxygenated blood. And then it gets out throughout the body through this aorta. And now let's consider this left part and right part of the heart. So their roles are a little different. So they basically do drive blood. So the right side of the heart, it drives blood through this pulmonary circulation. The goal is to get the blood oxygenated. And with that oxygenated blood, the left side of the heart does do sending out throughout the whole system. So it's called systemic circulation. So then think about this hardworking heart. So how does the heart muscle, which is continuously working, this also does have to get the nutrients. So there will be a blood to the heart itself while heart is working. So that we call as a coronary artery system. And I'm going to show you over here. So this is a very simplified one, but now I'm getting into more realistic. So the veins are coming from upper side, head, and upper body and upper limbs are getting into superior vena cava, and lower body is coming inferior vena cava, giving the venous blood to right atrium, and they get through this valve and then eventually go to pulmonary artery. And the oxygenated blood comes back in through pulmonary vein like this, and they get into left atrium and left ventricle And through this, there are valves, and then they go to aorta. You look at this interesting shape. So this one goes to upper body, and this aortic arch, this main part goes down towards our organs and lower limbs. And to provide blood for our heart, we have blood vessels on the surface of the heart that we call artery, coronary artery. So you can see this, you see again, left part of the heart and right part of the heart. So this left part called LCA, or left coronary artery, or right coronary artery. So in the majority of patients who suffer from heart problem, for example, angina pectoris, which is a symptom when the vessels of this coronary artery get thinner due to the growth of atherosclerosis, and that patient sometimes get a lot of pain in their chest. So it's almost like an elephant sitting on top of your chest. And if that become rupture, that part of the vessel ruptures, like denoted here as 1, then it actually causes ischemic issue on the downstream. So you see this part of the heart is partially non-functional, or eventually it dies. Then we call it myocardial infarction, and that can even people get this heart attack and can die. So this rhythmic contraction of the heart, we call it beats. So heart beats are normally like about 60 to 70 beats per minute. Thinking about this is about once per second. I guess our second system may come from this heartbeat from the human. Now, with these 4 chambers of the heart, they have gate, and that gate is interestingly one-way gate. So we call it as a valve, heart valve. So we have 4 one-way valves. So this is a major outflow tract into the heart and openings between the atria and ventricles. And they have names. I want you to understand their names. So for that, I want to show the actual valve system here. So from the right atrium, entering into right ventricle, there's a big valve, which is called tricuspid valve. So you look at the shape, it's like a sharp shape. This we call cusp. Or you look at this, a sharp teeth. The names are tricuspid because it has 1, 2, 3 lobes. And then this right ventricle, you send out deoxygenated blood through to the lung. That's called pulmonary valve, which is in here. And then after this, the oxygenation through the lungs, and then it gets into the pulmonary vein to enter into left atrium. So the left atrium to the left ventricle, there's a big valve, which is, you can see there's a 2 cusp, so we call it bicuspid, or people call it as a mitral valve. And that mitral comes from Latin belt or turban shape. And then the blood inside the left ventricle, now you are pushing this blood through the systemic circulation, through this, that gets into the aorta. So the name of this valve is aortic valve, as you can imagine. So what happens if there's a problem in this valve system? Here I put an example here. So aortic valve, when there's a pathologic process going on, that this valve gets narrowed down by fusing and thickening of this valve. So here is an example of aortic stenosis due to rheumatic heart disease. Then this aorta, it may not be able to push through this valve. So in that case, this patient may need an artificial heart valve, which I already showed you before. So then artificial heart valve is now pretty good, long lasting. The problem of this artificial valve can cause a turbulence after this valve. And what's the problem of turbulence in flow, blood flow? Turbulence can cause a stagnation point within this system, which means the blood doesn't move very much. So when the blood stops flowing, it can cause a blood clot. So the clot, which by chance can form here, that shed through this aorta and that gets into the brain, you can get ischemic stroke. So this is why that's a very, artificial valve has also an issue by itself. It increases the risk of stroke. Now, so what's the driving power for the heart to contract? The heart is a very interestingly made out of heart cells. So let's think of in our body, what are those kinds of cells that is excitable? And you can think of two cell types. One is neuron in our nervous system, and the second is heart cells because it contracts. Okay, so these contractile heart cells, we call it more academically, cardiac means heart, myo means muscle site cell. So it's just literally heart muscle cells or cardiomyocytes. Or you can just change the order, calling myocardiocytes of the heart wall. And the heart wall, we can also call it as a myocardium, muscular heart. And these heart cells are electrically excitable. And that's like neurons, and they can exhibit, neurons are excitable cells. And those already from neuroscience or basic biology. And neuron cells exhibit action potential. And what is action potential? Action potential is a propagating electrical potential changes of the cell membranes, and which makes an impulse along the membrane of a muscle cell or nervous cell. So this is called action potential. And just remember about the neuron. Neuron has about 3 parts. Their shapes are all different, but basically they have cell body containing nucleus and a lot of protein generating machineries. And the cell body has a lot of branches, which is called dendrites, basically obtaining signal from or other neurons. And with that signal combined, and then neuron decide whether it will fire or not, which we call action potential through this long branches called axon, which sometimes wrapped by myelin, and they have a structure, and at the end they have branch which were attached to another neuron or muscles. Another neuron, they actually touch, not physically, but there's a gap. We call it as a synapse. So this is pre-synapse and post-synapse. And between them, they have a connection, but this transmission of the action potential is now chemically done. And that we call chemical synapse. And this is a neurons communicate with the others via a synapse. But what about heart cells? Heart cells are also excitable, means heart cells exhibit action potential. That excitable heart cells are connected through not, chemical synapse, but they connect the electrical synapse. That we call gap junction. So let's take a look at the heart cells, the connection. So heart cells are connect to another cells, neighboring cells via this called gap junction. So electrical activity enters, and that actually spreads to another cell via this gap junction. So once this heart is electrically action potential is generated, and it will provide spread. So spread to adjacent cells, So it kind of, once it started, it keeps spreading its electrical potential, and that potential means the heart cell has of course it contains ectomyosin, so it will contract. So I'm gonna show you this gap junction. So gap junction is a specialized intercellular connection of connecting two cytoplasm between adjacent cells. So it looks like this, and it's composed of connexins, and it can close and open. And so it communicates the cytoplasm and electrical activity between adjacent cells. And this gap junction sometimes we call electrical synapse. Now, the heart to move, to properly function, it has to be very well coordinated. You know, the pump to work very well, it has to be temporally and spatially. So spatial temporal control should be well done by this conduction system of the heart. So some of the cells generate action potential with external stimulation. So what's very interesting in the heart is when you do experiments, let's assume you took out of the heart from mammal of experimental animal and you put it into a proper electrolyte solution. You know what happens? The heart will beat by themselves, even if it's disconnected from the original body. So the heart do not need a brain to make their beat. It will beat by themselves. Okay, that's very interesting. That means the heart has some mechanism to generate a beating by themselves. So that's specialized part exists in our heart. So one is sitting in the right atrium. That's called sinoatrial node. So sinoatrial, or simply a sinus node, or SA node, we call it. And that SA node is a rapid natural pacemaker of the heart, which beats by itself about 60 times per minute, okay? And that SA node is there, and then the next, there's another system called atrium, between atrium and ventricle, called atrioventricular node, simply AV node, and that conducts normal electrical impulse from the atria to the ventricle about slower rate, about 40 times per minute. So how does this form our heart? Here's a better diagram here. So sinoatrial node here is, and it's connected to this AV node, while it also goes through this left atrium. And this system allows us that this is faster. So it actually drives. SA node beats faster. And that means AV node is kind of covered by SA node because it goes much faster. But what happens if there's a SA node got problematic with a disease or certain, then the heart will stop, beating, and we have to die. So this is like plan B system, having this AV node, which has a naturally pulsing capability about slowly, like 40 beats per minute. If SA node doesn't work, AV node will take over the function while slow, but it can still contract and making the pumping function of the heart. So this is nice, backup system in our natural heart. As I said, the heart will beat by themselves. So what about nerve from the brain? So nerve input to the heart from our nervous system, such as sympathetic or parasympathetic nervous system, which can increase or decrease the heartbeat. And that nerve is not used, it's not initiate the contraction, but to modulate the heartbeat. Okay, so now let's think about this cardiac conduction system and contraction of the heart. So this has designed very specially. So specialized conduction pathways allowing the signal to travel faster to certain region than the other. And there's a reason why. So first, this special system is made bundles of special fast conducting fibers. First of all, action potential is generated at the SA node, and they spread first. There's the atriums and ventricle. So atria should contract first because the role of atria is to pump the blood into the ventricle. So action potential from SA node need to spread first both atria. And you have to make sure, so that's why this arrow is becoming darker and thicker. And then, you know, you need to give some time until you get into this AV node. So that's designed. After a brief delay, so we call it as AV nodal delay. And so this action potential spreads to AV node. And then what happens to AV node? For this ventricle chamber to properly function as a pump, you can't pump from the top to bottom because the bottom is like this. So you have to squeeze from the bottom to top for a better pumping. So what that means is this electrical signal action potential should go faster down at the tip of the heart first. And then it starts to contract from the bottom down. This bottom is called apex. So after a brief delay, it spreads to AV node and rapidly conducts to the apex, which is the tip of the heart, the bottom of both ventricles. So these action potential, so this right side graph shows what happens to the heart cardiac myocyte. When it changes its action potential, the heart will contract. So it shows the action potential when it goes and down about 250 milliseconds. Then the heart will contract during the time. So you can ask question, why this action potential starts from here, should go one way, not the other way. And there's a trick, there's a mechanism for this, because once the heart cells will be excited, there will be this period they cannot, you know, contract, excite right away. So we call it as a refractory period. During the time the heart cell will contract. Okay, so, and this electrical activity is in fact, you know, transmembrane potential change. This membrane potential change is about, let's see, minus 90 to about 10. So it's about 100 millivolts range. Remember, this property of the heart action potential actually helps us to detect any issues or problem in our heart by using electrocardiography or electrocardiogram, ECG, because that we measure the cardiac electrical activity from the surface of the body non-invasively by putting electrode on top of the body. And because that reflects the external currents around our body that originated from the heart. And that ECG signal, in fact, is only about 1 millivolt changes. But the original one at the heart is 100 millivolts. So they decay. However, we can still detect. So next time we will now enter to study more deeply about these sequences of this cycle we call as cardiac cycle. And thank you for your attention.